Magandang umaga, Malacañang Press Corps. Welcome sa ating press briefing ngayong araw, May 22. In today's sectoral meeting at Kalayaan Hall with President Ferdinand R. Marcos Jr., the Department of Health presented the National Human Resources Master Plan 2020 to 2040. The proposed national workforce support system aims to address the gap in human resources for health. This is in keeping with the Philippines' commitment to meeting the UN Sustainable Development Goals. In the discussion, President Marcos highlighted the importance of a few themes from the NHRMP. They are a focus on human resources and preventive health care, the Bukas Centers or Bagong Urgent Care and Ambulatory Services, the corporatization of tertiary hospitals, investing in women's health, because women are marginalized and they are often the ones who take care of the whole family, and this has a multiplier effect in our healthcare system. And the need to include the 5 gems of tourism and the hospital system beyond first aid. And here to tell us is more about this is the DOH Secretary, Teodoro Herbosa Jr. Good morning, Secretary Ted.
Good morning, Daphne, and good morning to the Malacañang Press Corps and to everyone. Yes, indeed, we talked about the reforms that the President wants implemented in our healthcare system. It focused really on emphasis on primary care. We talked about how the idea of we're spending a lot of money on improving a lot of our specialty hospitals, but a lot of the diseases that Filipinos die from are actually preventable if we have good primary care services at the local level. So this was the gist of the presentation, wherein we will focus on number 1, health promotion and disease prevention. Number 2, acute care. And number 3, women's health. So these are going to be focused based on our presentation to him, the development of the Bagong Urgent Care and Ambulatory Services Centers. These are mid-level diagnostic and therapeutic centers which will give primary care, yung first contact at the community level, those that are more than 2 hours away from a regional hospital. This will be run by our doctors from our regional hospital, and we started this project last January, and we now have actually 10 operational all over the Luzon, Visayas, and Mindanao, and we expect to open another 8 in the next few months. We are targeting as much as 28 for this administration, but I think we will exceed that because now I have 79 proposals from different regional offices. Attached to this is really a launch of mobile clinics. The DOH is procuring mobile clinics that will be used as a partner to go to the remote areas. And to complete the whole gamut from specialty center, regional hospital, Bukas, mobile clinic is the Purok Kalusugan program. This is a program wherein we will revitalize primary health care in the community and going down below the level of the barangay at the Purok level. So yan yung napag-usapan namin, including all others. We will need the human resources. So we saw the gap. Inesent ko sa Presidente na we have about 190,000 needed to actually fill in the gaps of our healthcare system. That's with the net flow, no? Yung mga nag-migrate at yung mga nag-OFW plus yung nag-graduate from our schools. May mga good news in the meeting. We had Ched described that under this administration, there are now 20 state universities and colleges that are graduating medical students. So malaking improvement yon from a previous of 8 in the past administration. And then we are also increasing our output of skills through TESDA. And then we also talked about the 5 gems wherein healthcare is needed, especially in our 5 gems, the 5 islands, Coron, El Nido, Siargao, Panglao, and Boracay. So these are the ones that we need to concentrate on, and we will improve the care not only of Filipinos but also of tourists that visit our 5 gems. Kasi gida areas yung mga island natin eh. They're really in remote areas actually. So pag may tourist na nagkasakit or na-injure, you can actually see na malayo sila doon sa health center. So we're trying to remedy that with Secretary Frasco. I'll end there.
Gita is geographically disadvantaged.
Geographically isolated
Isolated,
and disadvantaged areas. So ito yung mountainous and island provinces. Our gems are all island. They're in the top 10 island destinations. But because they're island destinations, to begin with, bago na-discover siya ng turista, walang healthcare talaga doon. So we now need to improve those island destinations too.
Okay. Thank you, SecTed. Questions? Raquel Bayan, Radyo Pilipinas.
Microphone?
Is there a microphone in the room?
Good afternoon, Sec. Nabanggit niyo po kanina yung 190,000 gaps na tinatry natin punan sa healthcare workers. Ano na po kayo update dun, sir, sa pag-hire natin ng healthcare associates po, yung nursing graduates na hindi pa po nakapasa ng board?
Okay, so tuloy-tuloy na yung program na yan, ano? Because most of them have gotten scholarship through the private sector, yung members ng PSAC, Private Sector Advisory Council for Health. And may mga nakapasa na actually. So may mga na-enroll na dyan, may mga nakapasa na, in some of them, I think 140 plus. And they're now hired as nurses kasi pasado na. But ang takers nung clinical care associate mababa because it's a salary grade 9. So sa government mababa. Ang success niya is in the private hospitals, yung mga na underboard sa private hospitals na nagkukuha ng scholarships.
Alan Francisco, PTV4.
Hi, sir. Itong human resources, sir, total na banggit niyo, sir, yung sweldo or kamustahin ko lang, sir, yung sweldo ng mga nurses natin, ng mga medical practitioners natin?
Okay, may misconceptions tayo sa sweldo, no? Kasi mataas na ang government salary for nurses. It starts at salary grade 15. Salary grade 15 is an equivalent of about 40 to 50,000 a month. And it goes up to nurse 2, which is salary grade 16 and then 17. Pagdating mo 17, parang nasa 75,000 a month. That salary is not given in the private hospitals. The private hospital gives about half. Some of the bigger private hospitals have started to increase, nearing 30,000, 25,000, 30,000, but it's still lower so that's the first migration from the private sector, lumilipat sila sa government items. From the government, lumilipat sila sa abroad. Sa abroad, the higher salary and the lure of migrating your family to another country. So that's another thing na napag-usapan namin, and there are some solutions na nasabi ni Secretary Hans Kakdak na 74% of our health workers that leave are nurses. And ang bright spot is that they recently signed a memorandum of agreement with Austria, wherein parang may scholarship na i-offer every time they take a Filipino nurse. So we hope that this will be the model to help us stave off the migration. The other thing we're looking at is not all people leave because of money. That's what I realized, because yung iba nag-nurse talaga kasi gusto nila mag-nurse at mag-alaga ng tao. Some of them will stay, and very soon may announce namin na we're actually allocating with DBM money to get health insurance. So may subsidy na ibibigay, maliit lang, pero it will allow them to get health insurance for themselves and even their family. So may PhilHealth na sila, they can get pa health insurance. The other one I'm doing is trying to provide housing for our healthcare nurses, because not everything is really salary. If you're able to provide, so ang kausap ko dito is DSUD about developing housing projects and pag-ibig. If you're a government nurse, makakautang ka sa pag-ibig and probably have a nurse. And the third is we're also looking at other benefits like education, wherein they can have career paths to actually develop their career, have scholarships, have a master's in nursing and become higher in the rank. And other benefits like even maybe a car plan. So the things are going to be given to them despite the fact that the salary is kasi comparable naman eh. If you have a high salary, your cost of living is also high in the US. Yung akala mo malaking sweldo mo, pobre ka din doon. Kasi you have to buy a car, buy a house, at yung credit card mo mauubos, you'll end up with a credit line. So actually, mas mabuti pa, piliin mo Pilipinas. So that's my program. I'm asking the nurses to choose the Philippines. Nabasa niyo yung tweet ko.
Okay.
Para sa
Follow up.
kanila yon, sa healthcare workers.
Okay. Go ahead, Alan.
Sir, Some are proposing to have floating clinics in our
Okay.
island LGUs. Your reaction on that, sir?
Yeah, kasi na-announce ko yung mobile clinics that will be launched soon. So we have the first deliveries of this. Yung mobile clinic, may x-ray, may ultrasound, may hematology, chemistry, and then may sariling generator. Paikutin natin to sa mga communities. And we procured about 83 of these. And this will be delivered in batches. Siyempre, may manufacture at ipuput together pa. And because of that, sabi ko kay President, we also need to build similar floating clinics for towns that are unreachable by land. Kasi marami tayong bayan sa Pilipinas na you can only reach them by boat. So we're thinking that healthcare can be given to them through the boat clinics. So that's the next step. Ano pa lang, idea pa lang yan. Although now, sea ambulances ang mga pinamimigay natin, I also discovered that in Sultan Kudarat, meron pala silang floating clinic na nagawa through the local government. So bibisitahin ko yan. Ina-invite ako ni Secretary Teng kasi yung anak niya yata ang governor ng Sultan Kudarat. So I'd like to look at that kasi may costing na sila. They have the costing, the model. So I'll look at that and probably find out if that's doable in the other island provinces as well.
Secretary, at the meeting today, you had some ideas for preventive healthcare. Maybe you can share some of those wonderful ideas here.
And I'm glad the president actually agreed with all of them because our top killers are actually heart attacks, strokes, diabetes. All of them are actually preventable. We end up with the, expending very expensive open heart surgery or dialysis for diabetic kidney patients. But actually, they're preventable if we had good diet. So sabi nga, Ted, di ba? Tamang pagkain, huwag kakain ng matatamis, maaalat at matataba. E, ehersisyo, every day, 30 minutes. And D, disiplina sa katawan. Disiplina sa katawan, huwag manigarilyo, huwag mag-vape, huwag mag-alak, at huwag mag-drugs. So TED, madali tandaan. You can write that. But the president agreed with the program on promotive healthcare. So you promote healthcare because the president is also health buff. Actually, he's healthier than me. I'm on my body mass index is higher. So I'm at risk with those diseases I actually described. And I'm trying hard. No, don't worry. And then there's also the fact that we also can do prevention. So ito yung mga vaccination, yung other things that you can do for a measure. For example, local chief executives can make sure there are bike lanes so people will move more. Make sure may mga Zumba dyan or whatever. So these are things related to health that's not directly healthcare but will impact on the health outcome of Filipinos. So the idea is longevity, being able to live longer na disease-free. So yun yung mga napag-usapan namin. And then, of course, what we need is acute care. Because sabi ko sa kanya, the second part really is making sure in universal healthcare, pag nagkasakit ka, may pupuntahan ka. Pagka masakit ang tiyan mo, nagtatai ka, or may ubusipon ka, may pupuntahan ka malapit sa'yo. Na sabi niya nga, hindi yung, because sometimes the difficulties are the maglalaba sa bahay, magluluto pa daw, at iniisip niya kung kanino iiwan yung mga batang alaga na iba. So sabi niya, sometimes the challenges are logistical rather than the money part. And then we have to think of that as well. So that's the third part of my agenda, and he loved it. Sabi ko, we take care of our women because our women take care of the health of the children, the health of the spouse, the health of the parents. But nobody takes care of our women. The women take care of each other. So he loved that. I will try to emphasize women's health, from breast cancer treatment, HPV vaccination, and all the things that women need. There's someone that needs to take care of them. So yun ang emphasis ko. They'll be my multiplier. Imagine if all Filipina women who become very good nurses and are in demand are taken care of. These mothers will be the ones who will make sure tama kinakain ng children nila, hindi naglalasing yung asawa nila, and all these things. I will have a healthier population in the future because of this.
Very good. Pia Gutierrez, ABS-CBN.
Hi, sir. Sir, if I can ask about COVID.
Yes.
Sir, can you confirm that more hospitals are reporting an increasing trend of COVID cases as what some are posting on social media?
Correct. Actually, well, there's only one hospital and that's just circulating. That's a private hospital, and ang statement nila, some of their health professionals have tested positive for COVID. But if you look at our data, our epidemiology bureau, our utilization for hospitals are still very low for COVID-19. So hindi pa tayo tumataas. Although I'm watching the events unfold in Singapore, because I think in Singapore has reported an increase in not flirtations, but the new variant of variant under monitoring. It's a variant under monitoring. So hindi siya variant of concern, variant under monitoring. And tumataas sila doon. They reported an increase in cases, and it's filling up their hospitals. So we're watching ours. We still don't have that number. We're asking our doctors and hospitals to report antigen testing. Because ngayon, the testing is not PCR na. Diba? Rapid antigen na. So we're asking our doctors to report that to our epidemiology bureau. The one we're monitoring really is ILI, or influenza-like illnesses, of which COVID-19 is one of those, right? So we monitor that. Luckily, even the one in Singapore is mostly respiratory tract infection, ubusipon, common cold, like. So I'm not thinking border control, mandatory mask. I'm not thinking that. But I'm advising every Filipino, since that's happening, that can come here, yung minimum public health standards. If you are sick, you have cough, colds, sore throat, it's better to stay home. If you need to go out, wear a mask. So it's still personal. And then there was a question to me about, should we get vaccinated again? Because the Ministry of Health of Singapore was saying it might be waning effect of immunity. That should be a personal discussion between the physician and you, the one with the request for a vaccination. Because I think the ones that need the vaccination are only the high-risk people. Remember, we have 78 million people that were vaccinated with boosters. So I think they still have some level of immunity. So no requirement for border control, no requirement for mandatory masks, no requirement for additional vaccination. But we're monitoring the cases. So,
Sir, is it possible na itong strain na to or yung variant na to is also present here in the Philippines? And could you tell us more about this
yes,
strain?
it's possible. Although the variant isn't serious, that's why it's only classified as a variant under monitoring. Di ba may variant of concern, and then yung talagang dinideclare nilang public health emergency of international. So it's under a variant of monitoring. Mabilis siya kumalat, so they're thinking nagwe-wane siguro ang immunity. Sa Philippines, we don't have enough samples kasi we need the number of samples to do the genetic testing. So ang report sa akin ng Epidemiology Bureau, we don't have enough samples that can be used for genetic testing. Pag dumami yung cases, then we will ask our Philippine Genome Center to again look at what variant is spreading. Parang ganun.
Last na lang, sir. Sir, how should the public take these new developments on COVID-19? Do you consider this concerning na?
You know, I'll explain to you, coronavirus, which is the cause of COVID-19, is actually the cause of our common cold. Nagkataon lang in 2020, there was a variant that caused very severe illness, yung COVID-19 pneumonia, that caused the death of even healthcare workers, nurses, and elderly people. And over time, what happened is we got immunization from the vaccines that were developed then, but the virus itself also mutated to a weaker strain. So if you notice lately, even if people get COVID, magpa-positive sila, pero 3 days, 5 days, magaling na uli sila. Especially for the young and healthy, there's nothing to fear. You just isolate, self-isolate, take vitamins, paracetamol, and you should recover. Risk are the people who are elderly, with cancer, with immune compromise. Sila yung dapat makita ng doctor nila and have proper, meron tayong mga antivirals, di ba? Yung molnupiravir and Paxlovid. Those are things that can also be had for these cases. So ang advice ko pa rin is wala pa tayong general policies like we did before. Kasi noon, bago lang yung COVID eh. So, but now, because it's just one of them, one of the respiratory illnesses, my advice to the public is minimal public health precautions. So, cough etiquette, di ba? If avoiding crowded places, ventilation of rooms, if the risk of getting it is going to be lower. Thank you.
Okay. Jinky Baticados, IBC.
Sir, follow-up ko lang yung kay Pia. Sir, following all these reports po, do we have now scientific basis for travel restrictions to any country? Kasi hindi lang naman Singapore, may India din. So, do we have now the scientific basis for that, for the restrictions po or travel ban? In any case?
No. As I said,
At
border
least para
control.
klaro lang sana,
Yeah,
sir.
para klaro, no? Border control. The Bureau of Quarantine is of course continuing to monitor this. Remember, may declaration form ka when you enter the Philippines. Pero online nga, yung e-travel, di ba, dinideclare mo yun kung may symptoms ka. So, binabantayan niya ng ating Bureau of Quarantine, which is under the Department of Health. So, we will have that data kung marami tayong turistang pumapasok na may respiratory symptoms and fever. But I will not recommend any border control. That means banning travel or whatever to Singapore or to India. The caution is precaution mo. You must be vaccinated at least, or if you're at risk, probably I'd advise don't travel there muna while they're having increasing number of new cases. Pero if you're healthy, maybe a regular mask that you bring along to protect you would be a good advice.
Jean Mangaluz, Inquirer.net.
Hi, good afternoon, Secretary. Is the government mulling a lower deployment cap for nurses amid the 190,000 gap?
No. In fact, if you have a good product, like a nice car or a nice TV that is being exported and is in demand, would you stop its production? No. I will just increase more. And that's where the direction we're going. Since our nurses are in demand, that means we're producing good nurses. What does that mean? We also get good nurses when you get sick in the hospital because they're export quality. So that means to me, I'll just produce more nurses. So the idea is the SUCs have started with the medical schools, but we're still trying to produce more SUCs with more nursing graduates. So para mag-increase din tayo ng nursing supply in the Philippines. So I'll increase the supply if the demand is high, not put a cap on it. So that's counterintuitive, diba? So I'd rather produce more nurses. Ang difficulty namin na pinag-usapan sa cabinet meeting was dentistry. Kasi as of now, there are only 2. Nung nag-hearing kami this week sa Senate of Committee on Health, yan ang tinanong sa akin about dentistry because we lack dentists. We have one of the highest dental caries in the world. And there are only 2 government-owned dental schools, University of the Philippines and West Visayas State University. And the reason for that is it's very expensive to put up a dental school because you'd have a dental chair per student. And million yun, yung dental equipment, yung everything to train. So most of our dental schools are private. And most of our graduates actually work in the private sector. So yung ating poor, ang pinoproblema namin is how to provide access for them to provide more dentists. So the idea is to increase the salary of our dentists, hopefully, and create more items. Pinapaaral ko na to because we have a law, a Republic Act for the National Dental Health Service. And we will try to revive dental items with a higher pay or create a public-private partnerships with the Philippine Dental Association to help. Hindi lang bunot, but really all gamut of care from, let's say, fluoridation, sealing, daily, yearly cleaning of your dental, rather than have many dental missions that are just all bunutan, extraction. Naubos lang ang ngipin ng mga Pilipino. Then we have to spend for the prosthesis, yung postiso, di ba, para makakain. Dentition is closely related to nutrition. If you have poor dental health, don't expect to have good dental health kasi hindi ka makakain eh. So, ayan, isa sa mga mukhang dapat tutukan namin yan kasi ang may government items lang na dentist ay Armed Forces of the Philippines. Meron silang dental corps. Ang some hospitals na kung minsan ay part-time lang ang nakukuha ng dentist kasi nga mababa yung sweldo for dentist. So, hindi lang nurses ang kailangan itaas. Dentist, medtech, radtech, PT, lahat niyan umaalis, nag-abroad.
Sam Medinilia.
Good morning, sir.
Good morning,
Um,
afternoon.
Ay, good afternoon. Regarding, sir, dun
morning.
sa nabanggit po yung regarding sa deployment cap. So, what is the proposal of DOH when it comes to that? Kailangan po bang i-retain, bawasan, or dagdagan yung deployment cap?
Ako, walang deployment cap. There is currently no deployment cap, and we will not put a deployment cap. They can work. That's free choice if you want to work. Now, our students that graduate from state universities and colleges, meron silang tinatawag na return service agreement. Some of them, like for example in UP, if you graduate from nursing in UP, you have to pay and serve in the Philippines. You cannot leave until you pay back the scholarship you got. Yan yung gagawin namin. We will just impose a return service arrangement, especially if you graduated from the state university. But if you graduated from a private nursing school, the moment you find a job anywhere else in the US, the UK, Australia, or some other country, there is no cap. They're free to go. They're right.
Ay, sir, i-clarify lang po namin, yung POEA kasi previously may in-implement na 7,500 annual deployment cap. Is that cap already removed?
Matagal lang nilift yun. That was only during the COVID.
Unlifted na.
Nilifted na yun. Because remember, when there was COVID, they put a cap on that. Nagalit nga yung mga nurse na may kontrata na eh. Kasi hindi sila nakaalis. So, I remember spokesperson pa ako ng COVID task force na. So, ang nangyari doon, nilift na rin. Nung lumuwag na, nilift na rin eventually ni President Duterte. So, right now, wala tayong existing deployment cap. Nurses, if they get hired, they can resign from their job and go work.
Sir, last question na lang po. Regarding po dun sa 190,000 na nabanggit po nila na kakulangan sa medical workers ng government, may timeline po ba tayo kung kailan dapat ma-fill up yung positions?
So this is not only government, this is the whole health system, including private sector. So ang estimate namin, kasi may mga estimates yan, yung number of doctors per population, number of nurses per population. Like our doctors, 1 is to 25,000 sa Pilipinas. Kulang na kulang. Ang ideal is 1 per 10,000. So kailangan triplehin ko ang numero ng doktor sa Pilipinas para hindi sila nakapila. Ang nurses may ganung number din, midwife may ganung number. And based on that, yun yung nakita namin that in the Philippines, with our current population, we need over 500,000. But we only have 300 plus thousand currently registered with our PRC. So kulang pa rin tayo. So we need to produce more. Basically, ang ginagawa ko kasi I'm expanding the healthcare system with investments by the national government and the help of the president. We're doing all these mobile clinics, bukas centers, puro kalusugan. This will require manpower. So ito yung gist ng aming meeting sa cabinet na I'm asking help of the rest of the cabinet members. Nandoon yung PRC, nandoon yung TESDA, nandoon yung CHED. So some of our solutions are using digital health. So we may have less manpower, but now I can apply extension like telemedicine, like what we did during COVID. So the doctor can be in the regional hospital, but they can see patients at home through a phone. So that's one other way, telemedicine. The other one is yung test na may program silang NC1, NC2, which are skills-based. Bago ako makakuha ng RadTech na na license by PRC, yung mga devices ngayon, kung minsan very automated na, kailangan mo lang i-on, alam mo i-plug, at alam mo i-on yung device, the machine will do everything, even laboratory. So, kung medtech pa hihintayin ko, napakamahal nun to ask a laboratory. Whereas, devices now, parang cellphone lang, isang click mo lang, it can operate na. So, we need technicians. So, ang thinking ko, we will need technicians to multiply our capacity. So, yung technician na yon na may NC1, basic, NC2, advanced skills, we're hoping magkaroon ng program na i-allow silang mag-college sa SUC and then get their RadTech degree, get their MedTech degree or PT degree eventually. So, parang ganun yung extension natin. Similar to the nursing coordinator, di ba? Yung skills muna and then pang-expand ng ating. So, si Secretary Teng Mangudato, may program siya for barangay health workers na may mga TESDA sa barangay to help them with skills that will help us in the health sector augment the deficit ng mga licensed health worker. Matagal kasi kung license eh. Tinatanong mo ako sa time frame, ka-graduate ka ng 4-year degree, magbo-board exam ka, at saka ka pa lang magtatrabaho sa gobyerno. Ang tagal nun, di ba? So, yun ang problema talaga. And hindi lahat ng pumapasa sa college nakakapasa sa board exam. So, nag-attrition pa yun.
Okay.
Pwede sa natin.
Maricel Halili, TV5.
Hi sir, magandang hapon po. Sir, going back lang dun sa COVID-19, did you discuss this with the President earlier? What did the President tell you about COVID-19?
Unfortunately, we didn't. No? It wasn't discussed. He didn't ask about the COVID situation. So, our press release is from our observation. So, I had a press release done yesterday pa regarding the COVID situation and that notice by one of the private hospitals about COVID cases. So we're monitoring it. That's our job. The Epidemiology Bureau and is the Disease Surveillance Bureau of the country. So we'll monitor it and we'll give you updates kung talagang may uptick. But in the meantime, the advice from the Health Secretary is minimum public health standards. The same things we do, what we've been doing.
Okay, and you mentioned earlier that this flirt variant is not that serious, but how does it differ from other variants like yung sa Delta, gaano kabilis siyang makahawa, ilan usually yung nahahawa niya kapag na-expose?
So apparently, mabilis siyang makahawa because of the outbreak in Singapore. So it's contagious but it's not virulent, that doesn't kill. Kasi wala pa silang reported deaths. Right? So yun ang binabantayan natin. The behavior of this new variant. That's why it's a variant under monitoring. We're monitoring it. And we'll look at it. Maybe it's nothing to worry about. So, or maybe it will just die down from the activities there in Singapore. I don't know. Iba ang conditions dun eh. But we'll also monitor here kung may mga cases dito.
Sir, last na lang. You mentioned earlier about the lack of dentists, yung shortage natin. Do we have figures gaano po kadami yung gap natin sa dentist in the country?
I don't have the figures really, no, but alam ko talagang kulang talaga ng dental. Number one, the dental positions in government hospitals and rural health units, kulang talaga ng dentist. So some would buy dental chair and dental equipment pero walang dentist na mag-work. So we ask private sector to help out. Private sector naman, volunteerism lang. So we'll compute. I think that's a good question, and I like what I did for the nurses and the doctors. We will compute what the necessary demand. Our difficulty there is really putting up more dental schools kasi mas mahal. So that's why the dalawa lang yung may dental school na government. The investment is so much higher kasi each student needs a dental chair. Yeah, and with all the dental equipment, yun ang expensive.
Okay. Questions from Ivan Mayrina and then Tuesday New.
Good afternoon, Secretary.
Hey, Ivan.
Para sa publiko ho, kung sakaling makaramdam sila ng flu-like symptoms, halimbawa, do you encourage them to get tested? Or does it even matter if it's COVID, if it's pertussis, or the seasonal flu?
Hindi ako magre-recommend siguro, but it would be nice to have the testing. If they have access to testing, that is recommended. Of course, you'd know what you're sick of if you do the testing. But if you do the follow the precautions of self-isolation, wearing a mask if you need to go out, you'll also prevent its spread. So that's all we need. And then hydrate, take paracetamol for your symptoms, and consult a physician. I think my advice would be if your respiratory symptoms are not clearing up in 5 days, it's time to consult with a physician. Thank you.
Hi, sir.
Yes.
Sir, nabanggit niyo po kanina, maybe nothing to worry about. But given this data na you have, your circumstances, at saka yung sinasabi na increasing na yung COVID cases as of yet dito sa Pilipinas, yung ating healthcare facilities po ba, may pangangailangan na paghandain na rin sila for possible surge ng cases ulit?
Maganda yung tanong niya eh. Kasi tinatakot niya yung tao eh sa COVID. Tatakutin kita kung anong dapat mo makatakutan. Pangataong Pilipino namamatay sa heart attack and stroke, cancer, diabetes. Yan ang isulat niyo. Because that's what I want people to learn about. I want them to learn how to prevent getting a heart attack, how to prevent getting a stroke, how to control their hypertension, how to control their diabetes or not get diabetes. I think that's what's more important. Yung top 10 killers natin, yun ang dapat sinusulat natin for health literacy. Because all of these are preventable. Yung COVID, ubusipon lang yun.
Okay. This concludes our press briefing. Thank you so much, Secretary
Thank
Ted
you.
Herbosa, and thank you, Malacañang Press Corps. Please take care, everyone. Good afternoon.